Thank you, Abdul. Aradhita, welcome to this session. It's a pleasure to have Aradhita chairing the next session.
Thank
Aradhita is
you.
an IRMI fellow at IGIB, and over to you for chairing this session.
Thank you, Dr. Savita. Good afternoon, everyone. And I welcome you all to this session of IRMI Annual Conference, which is kind of a continuation from the previous session. And this one is themed at evolution of research offices at a matured stage. And I would rather say that all research offices have to continually keep evolving to keep in pace with the changing academic policy and administrative changes. And like we saw in our in the previous session, that proactive approach works for the research offices at early stage. In a similar way, the proactive approach also works for the mature stage research offices. So with the experience that they already have, they can do proactive planning, proactive management, and then finally proactive meticulous implementation of the projects. With this, I would introduce today's speakers to you to tell us more about this. Our first speaker today is Dr. Sara Iqbal, who is an assistant research manager at George Institute for Global Health. She did her PhD in biochemistry from Aligarh Muslim University, and I was happily surprised to see that she had done her postdoctorate from Institute of Genomics and Integrative Biology. That is where I am at the moment. She's worked as a grant advisor at India Alliance, and her interests are in science funding, policy, and writing, and she has been actively participating in the dissemination of these. Our second speaker today is Dr. Ponnari Gottipati. She is a research management, science education, and public engagement consultant based in Hyderabad. She has been trained in molecular biology with a PhD from University of Sheffield, UK, and a postdoc from University of Oxford. She also co-leads the Superheroes Against Superbugs public engagement initiatives on antimicrobial resistance. And today she would be speaking about insights into the impact of grants office on research management and identifying opportunities. I would now request India Alliance to kindly switch on the talks. Thank you.
Good morning, everyone. I'm really excited to present my findings on the growth patterns of 3 different research offices associated with the George Institute for Global Health. I will be presenting this within the theme Developing a Successful Research Manager. Now, a lot of you must be wondering why study research offices? Is there really a need? To that, I would say that there's a person by the name of Scott Weiss, an American venture capitalist, who once said that, well, there's no substitute for real experience. I believe it helps to hear and share stories of resourcefulness in action. As a newly minted research manager, I cannot agree more with this statement. In India, where there are no certificates or degrees to teach us about research management, most of our learning happens on the job. And within this framework, I have been immensely benefited by the experience of my peers and my seniors. And today, by sharing my findings, I hope that other newly minted research managers like myself would be able to learn from our experience, and more seasoned professionals, after having established very successful systems and processes in their respective institutions, would be able to reflect back on their own journeys. Now, before I delve into the study, I would like to give an overview of our institution. So George Institute for Global Health is a public health research institution focused on the areas of non-communicable diseases and injury. We began as a single center in 1999 in partnership with the University of Sydney with just 5 staff members. We then expanded our operations in India, and independent center was established in 2007 in India with, again, just about 5 research staff. In 2013, TGI UK was established, although activities had begun prior to that. And this at that time, there were just 3 research staff associated with TGI UK. Today, we have affiliations with the University of New South Wales in Sydney and the Imperial College London in TGI UK. It's interesting to note that it's only much later that a need for a research office was felt, and it was set up in 2007 in Sydney. We then expanded our operations, and another research office was set up in India in 2018 and around the same time in UK as well. To study the growth pattern of these research offices, I've used a mixed method study, where I've looked at the historical funding data and also conducted in-depth interviews with 14 individuals, 5 of which were research managers and 9 were researchers at different stages of their career across these different regions. The aim of the study was three-pronged: to capture the journey, to understand the scope of work, and also to document the activities that researchers found most useful. For the sake of this presentation, I'm going to focus just on the journey of the research officers and the scope of work. So I first started by looking or trying to understand why were the research offices set up in the first place. In Sydney, there were 2 key activities: mapping funding opportunities and establishing reporting guidelines. Our key informant from Sydney tells us that at the time there were no centralized processes, and people simply didn't know how many applications were being submitted. This is essential for developing a funding strategy, and hence the need for setting up a research office. In India at the time, the institution was expanding its research scope. A lot of new faculty had joined who were interested in putting in applications to get more funding. And the need of the hour was setting up a strong pre-award management system, which is why a key informant from India was hired at the time. TJ UK has a very interesting inception story. The key informant was hired to help with Oxford India Health Research Network. This is a scheme dedicated to early career researchers, but slowly they also started sharing opportunities that were relevant to the wider Oxford community. And this particular function was considered very vital and was carried over to TGI UK when the institution was formally established. Over the years, the institution has grown by leaps and bounds. Since 1999, we've raised about $1 billion Australian for health and medical research, published 9,000 plus papers, and have conducted projects in more than 50 countries. In terms of research funding, there has been an increase in year-on-year funding that we've been awarded with. Compared to 2019, we received 29% more funding in 2020. And compared to 2020, we received about 14% more funding in 2021, and awards are still trickling in, so this number is bound to change. Now let's look at how have the research offices evolved over time. So from just one person looking after the operations in Sydney, we now have 4 people who help with the research services support in Sydney. In India, there are 3 people, 2 of whom were only hired in the last year. And in UK, 1 person continues to support the functions of the center. We also have 3 global positions, and these people help in streamlining and coordinating functions across the different regions. In terms of scope of work, again, all these 3 different regions have taken a different curve. In Australia, the onus has been on developing global SOPs. They also lay down a lot of groundwork for the quality framework within the institution. They also supported both the India and the UK research offices in the early days of inception. And they coordinate a lot of grants and also try to leverage other University of New South Wales programs that can benefit early career researchers at the George. In India, the institution had other priorities. One of them was collaboration across researchers, and we started doing that with the curation of the research forum. The office also manages ethics submission, develops regional strategies to attract more and more international grants while looking at project operations and also capacity strengthening. In UK, because it's a smaller office, there is more tailored mapping of funding opportunities where the manager works personally with the researchers and helping them identify opportunities that would further their development. And then coming to the global positions, they help in data management, and they've also helped in setting up of the knowledge management system that kind of helps build and coordinate the strategy across all these 3 different regions. So when I look at the timeline of the change in scope of the office, I think that there are 3 different phases. Phase 1 was more where we sort of laid the groundwork and established reporting guidelines, also set up a system for the internal review of applications. And this lasted for about 3 years. Then as more and more submissions started going out from the institution, there was a need to hire another person. The office expanded a bit. And this person started helping not just with submissions in Sydney, but also in India and other associated regions. This lasted for about 4 years. After which there was phase 2 extension, where again we sort of expanded the workforce, beginning with the setting up of research offices in India and UK, and there was also a shift to post-award data management. And then we come to phase 3, which is now, and here this particular phase deals with the establishment of CORE, or Center for Operational and Research Excellence. This helps in knowledge management. We also have now very tailored regional strategies. The regional offices have evolved, and so have the strategies for managing and attracting funding. We've launched a knowledge management system that helps us coordinate functions across these different regions, and then there is onus on a focus on data quality and project governance. And when I look at the functions of the research office, I find that there are 2 peaks where there has been most increase in scope of the office. The first peak was during phase 2 extension, when we started applying for a lot of international funds across these or in collaboration with different regions, and which require the development of global SOPs that align with multiple funders, international funders, and also in line with what was happening internationally in the scientific ecosystem. The funds became very competitive, and we had to ensure to provide our early career researchers with opportunities that would help them with capacity development and keep them competitive. The other peak is something that we are noticing right now. With a sophisticated knowledge management system, we're getting data that gives us insights into how to tweak our regional funding strategies across different regions. We're using these metrics to understand how to use this for creating more impact and engaging with our stakeholders. We're also cognizant of a lot of dialogue that is happening across internationally about open access policies and data management, and we are continuously tweaking our institutional policies to stay relevant in the international circuit. And just as the trajectory of the scope of work of the offices has changed, so has the trajectory of the research managers. And I'd like to present some examples. We can take a closer look at them. So beginning with this example. Now, this person, prior to joining George, this person worked as a technical assistant at the central office in one of WHO's program offices. They then headed the admin division of Center for Chronic Disease Control before joining TGI as a temporary staff focused on early career funding opportunities. Slowly, they also started taking care of other operations associated with funding, so peer review, supporting researchers in submission, etc. In their own words, they say that I started with, I think, 2 days a week, then it became a 3-day week position, and then became a full-time position. And, the responsibilities and the workload also increased accordingly. And today, this person contributes a lot in terms of strategies for the global office. They mentioned that at the end of the day, what I believe is that there are people and systems. Systems provide us with the framework, but it's how you deal with people that makes a difference. And that's something that this research manager has been focusing on and says that has been very productive for them. I see their position evolving from laying down the structure to developing its function, and that finally leading to impact. Let's take a look at a second example. And in this case, the research manager had a prior experience of working with the National Funding Agency, also at a research institution before they joined TGI. At TGI, the first year priority was to build a one-on-one relation with every researcher to understand their needs and to create a system for sharing points. They were also very focused on their personal development, and 3 years into this profession, they applied for a personal development grant. They mentioned that the course helped them in understanding the skills and the gaps that they had to strengthen in order to transition to a leadership position. And a leadership position sort of presented itself almost immediately. And one of the things that they had at the back of the mind while taking up on this position was that I don't work with these set of researchers who they were supposed to lead. And I'm not the reporting head, so why would they listen to me? And the advice that they were given with was that you are the one who will have to ensure that they are accountable for the tasks that you said. You have to give them a goal, and you have to ensure that they stay on track. And that sort of happened. They completely came into their own in this particular role. And I see their position moving from support to that of guidance. Let's take another look at another example. So here, in this case, this person was working at an established research office in an international setting, but had no prior experience of setting up systems. And that is exactly what they were hired to do at TGI. In the past 14 years, they have moved from just being a research services manager in Australia to being a research services manager globally. They mentioned that when I took on the role as the co-director, one of the things that I wanted to make sure is that those groups do not exist in silos. When he says those groups, he means the groups that take care of data management, project operations, quality framework, and also research services strategy. So they sort of try to find themes that cut across all these divisions and bring them all on the same platform for smoother functioning across the regions. One of the learnings that they speak about while talking mostly in terms of applications is that the number of applications is so large that you cannot implement the same process that you were dealing with 14 years ago. They also mentioned that there's a struggle when you come up with a great system because you think you'll work with it for the next 10 years. And after 10 years, you suddenly realize that the system is not working. And then, you start thinking, is it me failing or is it the system? The key learning or the takeaway is that you should always adapt to change and change with times. For them, I see their position moving from that of an enabler to that of a leader. And with that, I come to my final slides. While looking at all these journeys, unique journeys, I've come to the conclusion that the research trajectory of a research officer is more of, it's shaped like an inverted diamond. You begin with.
Hello, my name is Ponnari Gottipati. I work as consultant grants manager at LV Prasad Institute in Hyderabad. Today, I'm going to take you all through the results of a survey that I had conducted at LV Prasad, which is a clinical research institution, to gather information on faculty's perceptions of the new grants office that I've set up here. The main objective of the survey is to gain insights into the impact of the grants office on research management at the institute and to identify opportunities and priority areas to improve research support services. Just a brief introduction to the institution. LV Prasad is actually a network of 264 eye care centers. There are 10 arms to its operations, and research is integral to the operations at LV Prasad. Research is spread across various disciplines and locations. So previously, the information was managed locally, and there was also lack of uniform practices, especially with regard to post-award processes among the network, and this added to the complexity in research management. I joined LV Prasad in April 2019, so it has been 3 years of operations at LV Prasad. And during this time, I have set up a central grants office. I've streamlined different grants processes, especially the post-award services. As part of this, I have also set up an online grant management portal with the help of IRMI Grant. I also initiated pre-award services at the institution out of my own interest. The main aims of this survey were to determine researchers' perceptions of these different activities at LV Prasad and to understand their experiences of using these services and also their perception of the impact that these services have on research management at the institution. Survey was an online survey. It was open for 1 month and it was shared with faculty, but I've also requested faculty to also encourage others like students and other research staff that may have used the services to respond to the survey. The questions were mainly regarding the processes, the support activities, and also the new initiatives. And there were also some open-ended questions for them to give any additional feedback. The idea is that taken together, this will inform the existing and future research support services at the institution and also help establish a baseline that I can use for future feedback. So the survey itself was divided into 5 sections. Section 1 was introduction and informed consent. Section 2 was demographics, then the pre-award support services, then the post-award support services, and finally questions about the grant management portal. So we received 40 responses, the 55 faculty at the institution. The majority of the participants were faculty. So we can say that there's about 70% response rate among the faculty. And when I looked at the years of research experience, majority of them are have 9 or above 9 years of research experience. 15% of them are mid-career faculty, and another 15% are new faculty in their initial research careers. And about 17.5% of them said that they occasionally do research. I'm assuming these are mainly clinical researchers. When I looked at the categorization of research, 52.5% are clinicians and 22.5% are basic researchers. And both this and also their location is pretty much in line with the distribution of the faculty in the network. So I think there's a good representation in the survey. So when I asked them if they've used the support services provided by the grants office, 75% of them said yes, but there is 25% of respondents whom I have not managed to reach to so far with any of my support activities. So the first section on the pre-award support. So I listed out the different activities that I undertake and asked them what they've used. And majority of them actually look at the email alerts that I send out every week, followed by determining eligibility and suitability for a grant call, queries on grant applications, followed by funding opportunity webinars that I had conducted, and also help with budget sections, followed by documentation and also overall grant development, that is help from the ideation to the final submission. And then ask them how useful they think these activities are. And as you can see, majority of the grant is yellow. Yellow is useful, followed by green, which is very useful. So this was encouraging that they thought that the support is useful to them. And then ask them if they think this support increased their awareness of available funding opportunities. And 57.5% of them said there's a significant increase in awareness. 25% said some increase. I then asked them if they're more inclined to apply for funding now after the initiation of these services. 60% of them said yes, and 27.5% of them said maybe. So again, that's very encouraging to see. I asked them what additional support would they like to see from the grants office. And so green is useful and purple is very useful. Many of them thought external guest speakers would be helpful and a database of successful proposals would be helpful. I looked at this a little more in detail and categorized it based on their research experience. And 0 to 5 years research experience faculty actually sort of said that peer review of applications and mock interviews would be very useful. That's the orange here. Whereas the more experienced researchers voted more for the external guest speakers and database of successful proposals. So this again kind of helps me to give more tailored support based on their research career. When I asked them for additional ideas, some of the ideas that I got are to create a database of generic data on iCare and iResearch made available on the portal. Weekly tips from grants office covering different grant-related topics, or a quiz question to motivate and bring awareness. I thought this was a very interesting idea. Also to have all the required information about writing a grant available in the portal, followed by dividing all research persons. There's some ideas on mentorship. So they said divide all research persons into different groups on the basis of interest area. So the seniors can mentor the juniors, and also have one-to-one mentoring on grants writing. Then the next section was on post-award support services. And I again listed out the different activities and asked them what they have used. And surprisingly for me, about 57.5% of them actually said they've not used any of the post-award support services. So I looked at this a little more deeply, and I found that there's an equal distribution between young researchers and experienced researchers, but about 74% of them are clinical researchers. I then asked them, again, to rate these activities based on the usefulness. And though they've not used these services, again, a majority of them said that each of these activities are either useful or very useful. When I asked them if they think this support will ease the administrative burden with compliance and reporting, 40% of them said significant, but another 40% of them who said do not know. So then I looked at the data only from people that have actually used this support, and then 67% of them said that there was a significant easing of the administrative burden, and 29% of them said somewhat. Then I asked them if they think the support can streamline the fund release from funding agencies, and 32.5% of them said significant reduction in multiple iterations with funding agencies, but 37.5% also said they do not know. So I again looked at the data only from people that have actually used these services, and this is what it looks like. 54% of them said significant reduction in back and forth with funding agency, but 42% of them said somewhat reduction. Again, this was not surprising for me because of the difficulties that we've been facing with funding agencies, especially the Indian funding agencies with fund release post-pandemic. So it's very much in line with the ground reality. When I asked them what additional support they would like to seek from the grants office, some of the suggestions I got were fund tracking in real time, uploading reports in portals, timely alerts, and milestone and budget tracking. Again, all of these features are actually integrated into the grants management portal. So again, it was very encouraging to see that the features that are available on the portal are very much in line with the requirements of the faculty. So the final section of the survey was concentrated on the grants management portal. This is now christened as Gracias. So this was a portal that we developed in-house using the IRMI grant. This was developed in two phases. The first phase was launched in April 2021, and the second phase was launched in November 2021. So by the time I launched the survey, the portal has been in use for about 6 months. But when I asked the faculty if they're aware of Gracias, only 12.5% of them said they're very familiar. 22.5% said they're not at all aware. 27.5% said they're aware but not at all familiar with the system, and 37.5% said they're somewhat familiar. When I asked them if they've used Gracias, only 32.5% of them answered yes. Now, again, this was not surprising for me because I've really been struggling to get the faculty to warm up to the portal and utilize it to the full extent. So I asked these people, the 67.5% of the faculty, what their reservations are in using the system and why they've not been using it. This was an open-ended question, but when I categorized their responses, this is what it looks like. 43% of them said that they don't have any grants. 29% of them said they're not aware of the system at all. 14% said they're not interested. 9% said they don't have time. And a very small fraction of them said it was due to technical difficulties. So this 43%, I think, are very interesting for me because I'm assuming these are clinical researchers that do not have any extramural funding. But at the same time, the portal is equally useful to manage intramural grants and also sponsored funding. So I think I have a lot of scope here to sort of reach out to this fraction of people. A lot of work for me to do there. And then I listed out the main features that are available in the portal and asked them, how useful they think each of these features are. And again, majority of them said that all of these features are either useful or very useful. But I also wanted to get feedback from people that have actually used the portal. So when I analyzed that data, then I saw that the graph majorly looks green. Green here is very useful. So this was very heartening to see that the people that have actually used the portal thought that the system was very useful and the features were very useful. Then I asked them if they think the portal can streamline the administrative processes and bring in more efficiency. And 71.4% of them said yes. And when I looked at this data from people that have used the system, then 85% of them said yes. When I asked them if if they think the portal can help the LVPI leadership in strategic planning, 40% of them said yes. But there's also 25% of the population that said they do not know. So when I looked at the data from only people that have actually used the system, 54% of them said that yes, the portal they think will help the leadership, and 46% of them said maybe. So this was actually the admin portal that the faculty cannot actually see what sort of graphs are available. So I thought this was still a good feedback. So the final question in the portal was, if they would like to receive training. And again, majority of them said yes, especially postgraduates. Then there was an open-ended question for them to give general feedback. And this was, most of the feedback was about pre-award support services. They said physical interaction to know more about the grants would be helpful, need focused help in selecting a suitable grant. Portal could be more interactive. It was majorly positive, the feedback. They said great support, very supportive, happy with the new portal. Basically, I can track my deadlines and expenditure details. I can see all the documents on one side. Thank you for being approachable. We appreciate your ability to resolve issues quickly and your willingness to help where you can. The negative feedback that I received was majorly on the survey itself. They said too many questions in one survey or too big a questionnaire. So the conclusions are that the general perceptions of the grants office are overall positive. Activities that are currently being undertaken are either found or perceived to be useful. But there's a lack of awareness on what is available, especially among clinical researchers. I'm hoping that the survey helped in raising awareness of what is available, and hopefully there will be more users in future. But there's definitely scope to encourage clinicians to apply for extramural funding, and there's a need for me to reach out to them more actively. There's in general more interest in the pre-award support activities at the institution. So some of the possible future activities that I could undertake are periodic training sessions and awareness sessions on support services, weekly tips and other methods of outreach to increase general awareness of these support activities, more personal interactions, especially with the clinicians, external guest speakers from funding agencies, and creating a database of successful proposals. And for junior faculty, maybe set up a system for peer review and mock interviews. Thank you very much. I would like to thank IRMI for the opportunity, Dr. Savita specifically for the initial discussions about the survey, LVPI management for the support over the years, and Dr. Rao, who is the founder chairman of LV Prasad, specifically for his encouragement and for boosting the survey. Dr. Madhuri from George Institute and Dr. With from MBO, who have taken time out to look at the survey and give me useful tips. And finally, these are my contact details. Thank you very much.
Thank you. And those were really great representations of how research officers have been working at different institutes. May I please request everyone to switch on, the speakers to switch on their videos, please?
Hi. Am I audible?
Ponnari, yeah, yes, yes.
Hello, good afternoon.
So the chat box has been ringing, and Sarah, would you like to finish up something on the conclusive slide? I know you've written something, but would you like to add something to it?
Yes, thank you so much, Aradhita. First, let me say
You
that
are quite faint, unless it's just me that's hearing you faintly.
Can you hear me? Can you
Yes,
hear
ma'am.
me now? Okay, I'll
Yes.
speak into the mic then. So let me say thank you so much. I'm thrilled to be on the same panel as Ponnari. And regarding the conclusion of the slide, I have mentioned this in the chat, and I would like to say or reiterate this, that I feel that the journey of research managers is shaped like that of a diamond. So you begin with a very pointed set of instructions that you're supposed to do for the institution, and then you kind of build upon it, improve the system and processes as you gain more skills. And finally, when you build like a critical mass of skills, you transition to the position of a leader, and then find your own niche and govern in that specific area. But I believe throughout this journey, the message is that you should never forget the basics and always be open to change and adapting to change. So that's the conclusion. I would like to thank IRMI for giving me this platform to present this study. I would also like to thank my colleagues at the George who helped me with the study, and Madhuri specifically for the encouragement and guidance. Thank you.
And I think your slide, your comment, I mean, kind of addresses what Vidya has been asking here, that how is the individual development of a research manager with the trajectory of growth and expansion of the institute. Maybe both of you could add to it, and Dr. Savita could add to that too with her insights.
I think that's a very interesting question, and there are two ways of looking at it. I feel that one of the things that makes a difference is the support of leadership. So if your leadership is supportive, they would ensure that you have avenues to explore for your own personal growth and research. And in addition to that, I think there is something called personal motivation. So if you're motivated, I think you would find time, even in periods of extensive growth, you would find time to read about upcoming areas and build your skills in that. And I think IRMI is a great conference and a great platform to sort of understand the trends that are coming up, to earmark for your personal development goals for the next year. And I'd like to stop there.
Thanks. Ponnari, please.
Yeah, I agree very much with Sarah that with the organization expanding, I think the research managers also have a lot of scope to to kind of understand the areas that they want to grow into, because as the organization expands, then a lot more avenues become available for us. But obviously, we can't be doing everything ourselves. So as the research organization expands, the research management office also needs to expand, which I think is what Savita mentioned in the chat that happened with NCBS and also with the George Institute. It started off with one person, and now there are three. But with more people joining in and with more people kind of supporting each other, I think we will also have opportunities to identify the areas that we personally would like to, take up and sort of kind of those niche areas that we would like to grow our expertise in. Yeah.
Maybe Dr. Savita, you could have some insights from you on this.
Sure, thanks, Aradhita. So, yeah, it's true. Looking back at the journey of the NCBS RDO, we initially got started when the research enterprise itself was very small. But we were going to support the growth of InSTEM, which was built on a very different model through these large centers, which had many investigators with complementary expertise. So that was fundamentally different from how NCBS was organized. And I think as NCBS and InSTEM grew and the cluster itself grew, this really challenged our team and are thinking about what the research office needed to deliver on. And one of the lessons we learned was that it wasn't simply a matter of like a multiplication factor. It wasn't about replicating the same person, same role times 5 or times 10. That wasn't the case. What we found far more effective was to actually think strategically about the kinds of new roles that we needed to create, the new kinds of areas that the research office needed to support. At one point, we had to build the communications office for NCBS, and I was suddenly finding myself hiring a digital communications person, a graphics person, and so on and so forth. So, and then, of course, in the full course of time, all of these activities, they further evolved and the office split back into different functions. So I think this is the breathability of the organization, and the research office responds to what's happening at the organization. So Vidya's question is about what happens if there isn't extensive growth at the organization. How does that impact the research managers? I think when there is extensive growth, then obviously you're struggling to keep pace and you're putting new processes in place all the time. But when there isn't that extensive growth, and there is in a way that status quo, so one can consolidate the processes, maybe learn from other institutions and bring best practice back to one's own organization. But I would like to bring in a completely different point here, which is that if you're a research manager who finds yourself as an experienced research administrator at an institution where there isn't that much growth, where your processes have reached steady state, maybe one way to grow is to actually volunteer support research management in your geography at other organizations. So we are seeing example, for example, Vandana is a great example of that. Madhuri is another great example. So these are all individuals who are using their knowledge to help. And Ponnari, we heard that you're also, you've offered advice to Darren at CDFT. So I think this is a very nice crosstalk. And in actual fact, this cross-fertilization, the supporting colleagues at other organizations, that can open up new avenues for professional development. I'd just stop on that.
Thank you. Maybe Ponnari, you could take this. For uploading proposals or reports on funding agency portals, are PIs comfortable sharing their credentials to support them and speed up the process? You are muted.
So if this is uploading the final proposal on the portal for submission, then usually PIs do it themselves. They because most of the time you have to actually, there are a lot of questions on the portal that you need to fill in, which are part and parcel of the application. So usually PIs do that, but PIs are very happy to give you the credentials for post-award management. They very happily, like, please go do all the reports. I mean, submit the UCSCs on the portals. We're happy for you to handle that on our behalf. But another point that I would like to mention is the portal that we have now, the Gracias portal. We've actually expanded that to pre-award also. So the entire, some parts of the pre-award process actually happens through the portal, where the PI, I think we've heard something similar yesterday also, where the PI actually have to submit the proposal first on the internal portal. And then all of the scrutiny happens on the portal, and the dialogue between the research manager and the PI also happens on the portal. Then it goes to the director for the final approval. So all of that process is now being integrated on the grant management portal. And again, initially there was a lot of resistance. PIs didn't want to do this because, they were like, oh, it takes up a lot of time, or they were like, it's just a lot of effort. I have to do it here on an internal portal, and then again, I have to do it on an external portal. I mean, you're just complicating things. Why can't we just do it the way we were always doing it? But so it actually helped that the director was actually on board for this particular thing. And so the director insisted that the PIs will have to do it through this process only. And then the PIs had no other way. They had to do it. And once they got used to doing that, and once they realized that they are not, that the information that we are asking is actually not too much, and it actually doesn't take that much time to put that, and then having that conversation and having that archive of the conversation that happens between the grants manager and the PI also on the portal is actually very useful to them. So now a lot of PIs have actually kind of warmed up to the idea. And also, of course, the portal is built in such a way that there's a lot of confidentiality. Only the main PI and the co-PI and the grants manager and the director can actually see the application, whereas the other PIs will not have access to that other than the abstract. So they are now a lot more comfortable and are kind of warming up to the to that idea. So.
All right. Thank you. And I think there's another one for you. This is from Madhuri. She's saying that my main concern is also to create systems that will not be used finally. One way perhaps is having end users as co-builders while developing your system. What are your plans to engage faculties who are not using the system? I mean, not or reaching out more to them.
Yes, so
adding to this, Ponnari, I mean, how do you plan to reach out to those, or and kind of enthuse those who are actually not using at the moment?
Yes, yeah, so that has actually been a very, that has been an uphill task actually. Madhuri, I have actually, the PIs, many of the PIs have been part of the building of the portal itself. I've kind of had constant interactions with the basic researchers. I mean, the clinicians are too busy, so I did not actually go to them. So some of them were familiar with what we are trying to build, and many of them gave ideas as to what they would like to see in the portal. So they were that part of it. There was no problem at all. They were very enthusiastic about engaging on actually building the portal itself. But when it came to using the portal, unfortunately, there wasn't. There was a lot of resistance. I think it mainly comes from. They're just used to doing things a particular way, and it is an effort for them to break that and sort of start using something new. There was also a lot of resistance from the administrators, actually. That was another totally different ball game, actually, to get them to use the system. But what I am now doing, I have actually conducted a couple of webinars where I try to take them through the portal, told them all the great features that are there, how it's going to be useful to them. But again, only a certain number of people were attending these webinars. So what I have now started to do is to actually get the people who are already using it and who like the portal, make them the champions, and then get them to talk about, how these different features are helping them. And secondly, I think, so what happened, so when we're building the grants management portal, it was more a bottoms up approach that I came up with the idea. I said, let's do this, and then we built it. And it also, we kind of hired it, we've kind of put all the data in it already so that the PIs don't have to do it themselves. And then it was just managing the portal. But even then, the administrators didn't want to do it because they said, it's not our job. The PIs didn't want to do it because the PI said, oh, too much time. I don't have the time. So then again, we actually ended up hiring a person who would handle data on the portal. So that kind of helped to a large extent, because now all they had to do was just give the data to this person, and this person would sort of put in the information on the portal. Now, the funding opportunities are also on the portal. So now they have an excuse to sort of go to the portal, to sort of engage with the portal. And so we have also built a parallel system along with the grant management portal. We also have something called a project management portal, which is actually a duplication of the same thing, but for the internal sponsored clinical projects, the intramural clinical projects and the sponsored projects. And what happened there was that the management actually said that it was compulsory for everybody to use the portal. So there was no, you use it or you don't. Here it was like I was actually going and asking everybody, hey, use the portal. It's great. It's going to streamline everything. Whereas there, because of the experience we had with the Gracias, we called that the process. And there what we did was, the management said, use it. And then the PIs had to use it, and now they have warmed up to that portal. And now I'm just going to tell them that this is exactly the same portal. So, but for extramural grants. I mean, yeah. So these are some of the ways I think I will. And also, I'm also going to take that tip that I got from one of the faculty where it said, why don't you send like a tip every week or some sort of a quiz every week? I'm going to do that for the portal, I think. And I'm going to have a screenshot of something that, that is very useful to the PI and say that, what do you think of this? Is this helpful to you or not? Or something like that, maybe. And then, get them to look at the individual features so that they can sort of see what they think of it. But the management has been very supportive, and they think that the portal is very, very useful. So that's helpful. Yeah.
That's great to know, Ponnari, about the support that you're getting from the management. And of course, I'm sure in due course, everybody's going to warm up. Sarah, while I was listening to your talk, I was just wondering that, speaking of having a research officers at 3 different places coming up, so when these were being developed, these research officers, were they being developed de novo with de novo rules and regulations based on the country and the setup therein, or was there some kind of learnings that were being implemented from the other sides, from one to the other, and then building up upon that?
So when the first research office was built, there was no background in Sydney, of course. So that was like a de novo structure that we came up with internally. But then when we started expanding or setting up independent research office units in other countries, of course, there was cross-learning involved. We used the same governing systems. We used the same systems for kind of logging the projects that we were submitting, etc. So the groundwork was similar. There were learnings involved, but these were also tailored to the ecosystem. So for when they were setting up the India research office, there were some priorities for the India office that were not common between India and the Sydney office. So some kind of groundwork was borrowed from there, but then there were additional features that were added in. There were certain regulatory features that were required for for India-specific regulations and their funding bodies. So these were additional checks that were included in that the Indian research managers could fall back on while they were looking for funding opportunities and while they were looking for the needs of the institution and the researchers. Similarly, in China, there were other sort of regulations. In UK, there was another priority altogether. So again, we just borrowed the basic framework of reporting and then added multiple functionalities of what were required in those countries. Regional strategies are slightly different across these offices.
And do these research offices, kind of facilitate your collaboration build-ups, like at the different countries?
Yes.
So is there some kind of a portal or matchmaking kind of method that they use, or is it based on PI interests, or is it based on research office outreach?
It's a collaboration of all. So what happens is that we have regional monthly meetings, let me just call them RSS meetings every month, where all the research officers across the several regions meet. They discuss what are the opportunities that can be leveraged in different regions. If there are any specific country-specific calls, if say there is a call that has been announced by NIHR that the UK office comes to know of, something that we can apply to, they do let us know, and then we can prepare grant and collaboration. Also, in collaborating with the Imperial College London, in case we're putting an application together, the TGI UK research office plays a very, very important role because they are more familiar with their requirements, regulations, and guidelines. So they help us in that process. My colleague Madhuri is also on the call, and if she would like to add anything, it'll be great if she can.
Yeah, sure, Madhuri. You can unmute
No, I think Sarah has sort of done everything. It's just that we are more alert when we have these opportunities where other institutes can apply. So she's taken the name of NIHR, which likes UK and LMIC country collaborations. Like that, we have NHMRC and the GSCT calls, which like Australia, India collaboration. So it's played to our advantage actually to have these research offices in different countries. Thank you.
Thank you so much. And I think we are about at the wrap-up time here. It was really great interacting with all of you and having all the questions answered and interesting knowing how things are working.